Hello, everyone listening to the podcast. This is Devin Golden with Mesothelioma Guide, and I am on the phone with Dr. Marcelo DaSilva. He is the Chief of Thoracic Surgery Services and the Department of Thoracic Surgery at Advent Health, and also a medical director at Advent Health. He recently moved from Brigham and Women's Hospital in Boston, Massachusetts, to Advent Health in Orlando, Florida. And I wanted to just thank Dr. DaSilva for joining us today. So thank you.
It's a pleasure. It's a real great opportunity to connect with patients and their families. And I'm very energized and excited with the opportunity to reproduce and create a new program for patients with malignant mesothelioma in Central Florida.
So just to go over quickly, your career, you, again, were at Brigham and Women's Hospital in Boston as a thoracic surgeon and director. You were at Penn State as a professor of surgery. You were at Loyola University, Chicago as a cardiothoracic surgeon and chief of thoracic surgery. I know you were an instructor in surgery at Harvard University. I believe were an instructor or professor at Loyola University, a resident at New York Medical College. You are from Brazil, but you moved here around 30 years ago. You went to University Gama Filho in Rio de Janeiro. Just you've worked at a lot of, and that's probably more to your career and more to your professional accolades. But you've worked at a lot of different institutions that are well known for their mesothelioma programs. So I guess my first question is, why did you want to come to Advent Health here in Orlando to start their mesothelioma program, and I guess to kind of renovate it or remake it?
Right. So one thing led to another, but the short of it is we used to see a lot of patients from Florida up in Boston. We have a very robust referral pattern from doctors that goes from Miami. Some Caribbean doctors and Central America also send patients up to Boston, not to mention Mississippi, Tennessee, and other places that people have been either migrated to or been exposed to asbestos in the past. There's a higher concentration, but so we noticed about 40% of the patients coming from this area. So when I was looking at the opportunity to move down and really develop a thoracic or lung within the idea of creating a lung institute, I looked carefully about the mesothelioma landscape, and I thought there really isn't a robust multidisciplinary program in Central Florida, and maybe in whole Florida state. There are a few surgeons, and they are highly skilled, highly qualified surgeons, and I probably know all of them, but they're not within a robust program. Some of them are very strong on the chemotherapy and protocols. Others, on the other hand, would offer surgery, and what type of surgery, limited. But I thought there was a huge vacuum and a great opportunity for us to come down here and create something similar that we have to Boston. Look, when someone gets sick, they want to stay close to home. They want to stay where their family can come and visit. They want to be connected to their family, communities, church. It's important for them. I see patients as a whole. I don't see as a disease. And I think our holistic approach, which I've learned from Dr. David Sugarbaker, is exactly that, is creating something in Central Florida that would allow the patients not only to be treated with the best multidisciplinary team that we have, but also stay close to home, to their families, to their loved ones. I think that's very important. That's key in their treatment.
There's so many mesothelioma programs that are in the Northeast or the West Coast. There aren't many here in Florida and in the Southeast. So yeah, like you said, I think for the patients here, it's valuable to have something that's kind of closer to home, so that they're not kind of hard pressed to make those travel arrangements to kind of go out of their comfort zone. Let's go back to just maybe the very beginning of your medical career. Why mesothelioma of any disease? I know you're a thoracic surgeon, so I know you probably have experience performing treatment for all different types of diseases and health concerns in the thorax, but was mesothelioma something that you really wanted to focus on specifically? Were you influenced by another doctor? How did that kind of take shape?
So that's a great question. So Winston Churchill once said, the only cause worth fighting for are the lost cause. So I've done lung transplantation, and lung transplant patients are very similar to mesothelioma patients in a way that at different ages in part of their lives, they reach a wall, a very hard, thick wall with some dismal prognosis and something related to the end of life. And when I joined the Brigham 15 years ago, I was doing lung transplants, lung cancer, everything aspect of thoracic surgery. And then I was fortunate, blessed really, to be picked by Dr. Sugarbaker to be his partner. And as I learned from him and worked with him, I thought that if anyone can make a difference, that'll be a multimodality group of physicians. And when the patients come to us, most of them are given, which I called a death certificate. They go to their doctor, and the doctor says, you have mesothelioma. There's not much we can offer. You can get some chemo, maybe surgery, and they throw at the patient some odd, crazy numbers. And then when I was experienced that up in Boston, we start seeing patients living 2 years, 3 years, 4 years, 15 years, 17 years, 20 years. Some of Dr. Sugarbaker's first patients still alive. And I thought, this is not correct. People do survive. And so I started wondering about that and started really delving into the treatment of patients with mesothelioma. When someone gets sick in the family, the whole family gets sick. So it's not only about the patients, it's about the patient, the family, and really making a difference in their lives where most of people see no chance or minimal chance of survival. I see much more than that. So, out there, people say, I have to see to believe it. I have to see a patient survive to believe it. We never subscribe to that. We say, we believe it, and then we see it. We believe there is a cure. We believe we can make a difference. We believe we can extend life. And then we know what happens. We see them. I've seen families getting together, communities getting together about patients, and they go about their lives. It's very empowering to physicians to see that, because I believe we can make a difference. I believe we can really change the nature of this disease in the near future. That's why I decided to do and focus my career. I mean, I do everything: lung cancer, esophageal cancer, chest wall. I mean, you name it. But the mesothelioma patients, for me, they have a special place in my heart, because I know most of the places they've been to, they have been tossed around. There's no hope. And I usually tell them, when hope is part of the equation, anything's possible.
You're taking a lead role in the mesothelioma program at Advent Health. What's the first aspects, or what's the first objectives you're looking at to accomplish? Are you trying to, upgrade equipment, hire staff, build your team? What are you looking to do right away?
Right. Okay. So Advent Health has everything we need. They really have. And I have a great support from administration, and they are 100% behind our program. They're putting their resources where their mouth is. I mean, for the first time, we actually have the ability to do what we want. So Advent Health has the intraoperative chemotherapy. They have state-of-the-art chemotherapy medical oncologist group. We have radiation oncology. We have CyberKnife. We have rehab. We have nutrition. We have all the components here already, and they are really good. However, they're not under one umbrella. So my goal is to pull all of those resources, all of those extraordinary professionals into the umbrella of the mesothelioma treatment and create a program. And just this morning, I had 3 meetings, all meetings related to where we're going to put our patients, how we're going to put it all together. We're going to create an institute. We're going to get foundations to help us to develop our protocol, research protocol across multi-institution specialties. So all of that is coming together within the next month or so, but with the great support. And I have to tell you, the buying in of almost every single person I've spoken to for the last months. They are in it. They feel the need. They would like to be part of this. They see that it's much more to accomplish it than just being within a silo. You still create this great, which I think it's a great program for Central Florida.
It sounds like you said like you have everything you need already at Advent Health. It's just kind of organizing it and getting it together under one umbrella. So I mean, I'm not sure. Maybe you may look to bring in doctors from outside. Is there an oncologist on staff at Advent Health who is knowledgeable of mesothelioma and has already treated mesothelioma?
I have two great partners, and as a matter of fact, within our multimodality clinic today, I just saw a patient with mesothelioma from another institution in Central Florida who was offered partial treatment. And so Dr. Mark DaSilva is a fantastic med-oncologist, and Dr. Mikhail Tarek. They're both excellent, state-of-the-art, second-to-none medical oncologists. They're in it. They're in it for the long haul, and they're part of our program. I'm fortunate to be their partners, really. And so when we see patients, we see the patients together. So Mark DaSilva and Tarek Mikhail are my guys, yes.
Okay.
And it's going to be yours, too, if you come here.
Absolutely. So you have experience treating both pleural and peritoneal mesothelioma. Pleural mesothelioma is the mesothelioma that forms in the lining of the lungs, or the lining that surrounds the lungs or separates the lung and chest wall, and then peritoneal mesothelioma forms in the lining of the abdomen. You're one of just a few specialists and surgeons who has experience treating both the main types of mesothelioma. Which one did you learn first, and I guess kind of compare? And are you going to treat both at Advent Health?
Yeah. So the answer is yes and yes.
Okay,
so
awesome.
A few years ago, when I was working with Dr. Sugarbaker, we started seeing patients coming back with small recurrence in the abdominal cavity, or the mesothelioma was present in the abdominal cavity.
Mm-hmm.
And again, the same rule applied. They would see a different doctor, and the doctor says, we have mesothelioma. Your right head up on the pleura in the chest. Now we have in the abdomen. Forget about it. And Dr. Sugarbaker says, no, that's not true. We can go after that. So he asked me, he says, would you be willing to tackle that? I said, I would love to. So we created at the Brigham and Women's Hospital, we created the abdominal peritoneal mesothelioma program 5 years ago. And I have to tell you, it was very successful. I left the program a month ago, but it was very successful. We have 3 surgeons working for us. So and I want to do this here. So to that extent, I already talked to one of the surgical oncologists here, and he's willing to be my partners in doing the abdominal peritoneal mesothelioma. So so my program here will be tackling both abdominal peritoneal mesothelioma as well as thoracic pleural mesothelioma. Yes.
Okay. How many, I mean, in your career, and this includes your time at Brigham, obviously, because you were part of the International Mesothelioma Program and working with, Dr. Sugarbaker, many other specialists. How many mesothelioma patients have you seen? I mean, and you can ballpark that. You might not know the exact number.
Yeah, so we used to see about 110 patients a year. Okay. There of those, I probably saw 50 or so, maybe more, a year for 15 years or 12 years. So about 500 to 600 patients. I have thanks God, I have a good memory that allows me to remember many of them and their families, and I still get cards from them. Some of them will be following me here for follow-up, because we believe in the long follow-up. We'll never stop seeing our patients because we want to see them go through their lives, and some of them are coming up to 10 years. So it's a ballpark about 600 patients or so.
Okay. When you're this is a question I often ask specialists and surgeons and mesothelioma doctors. When you're communicating with a patient, again, this is an aggressive cancer. So a lot of times, and you've kind of talked about this already, a lot of times, there's kind of this, I guess, the stigma around the cancer that there's not much hope, but it is an aggressive cancer. It moves very fast in the body. There's, if you don't get that diagnosis right away, it is difficult to treat. And I think that's just kind of a reality of it. How do you communicate with patients and their families in terms of like finding the balance between providing the honest prognosis and also an expectation for what's coming in the next few months versus making sure they still have hope and kind of providing, I guess if you want to use the medical term or the doctor term, that bedside manner where you're still kind of giving that positive energy. I mean, I know that's got to be difficult, and it might be a patient by patient basis where each patient responds differently.
Yes. So I would say it takes, average, I would say, for a surgeon from the time he or she completes his or her training, about 15 to 16 years, to really understand that patients are not a disease process. Patients are human beings. They have feelings. As a matter of fact, feelings play a huge part. They have their spirit. They have their faith. They have whatever it is that keeps them going, besides just being a disease or heart or lung. So I try to tell them the following, right? So the diagnosis of mesothelioma, as you well said, it's like a black forest, right? It's dark, it's difficult. You don't know when you pass around, and you have to cross it to go to the other side. And I usually tell the patients, really, it's scary. I understand you're afraid. You'll be given a devastating diagnosis for which most of the physicians really understand that most of physicians in their lifetime will never see a patient with mesothelioma. That's how rare it is. So the patients feel that they have no place to go, this black forest. I usually tell them, listen, we've done this before. We have the roadmap to cross the black forest. There's no question about it. It's going to be dark. It's going to be cold. But we can get you across this to the other side if you follow our pathway, if you believe and trust in our treatment plan and put your mind and your heart into this, we can get to the other side. And then usually the patients ask, how long do I have to live? Is that a 6 months? There is 11 months. Numbers are numbers. Numbers are a collection of patients put in different buckets by stage, by disease process, by cell type. So there's a combination of factors that play into how long do you have to live. But at the end of the day, here's what I said. I don't have a crystal ball. I can't predict the future, but I can tell you how we're going to treat you. Mm-hmm. So whether it's 6 months, 9 months, 10 months, 2 years, 5 years, you're going to have to go through it. You're going to have to choose your options wisely. Get off the internet. The numbers are crazy. Some of the reports are just totally off the wall. I tell the patients, find the doctor, the multi-specialty group of doctors, oncologists, they all have to speak the same language. They all have to understand about your problem. It can't be just an excellent surgeon or excellent oncologist or excellent radiologist. They all have to be in the same boat as you are, looking at your specific case. You're the only person in the whole world. You're different from anyone else. So we look at that patient, specific patient, with our microscope, and we go over every single aspect. Another day I had a patient says, we're going to have to examine your eyes. And they says, why? You operated on my lung. Because the chemotherapy can have severe side effects on your eyesight. I need to know if you're going to be able to tolerate. And then he says, but you're not a medical oncologist. You're a surgeon. I said, yeah, but I see this. I treat patients like this. So anyways, what I'm trying to say is we go from every single aspect, the nutrition, the heart, the lungs, the kidneys, the GI tract, your weight, your smoke, you name it, to make a intelligent, educated decision and share that with the patient. And that's, to me, is the most important. Some people would say, no, cut it. Just tell me the month. I said, I can't. I can throw you numbers. They may or may not apply to you, but what does it matter? What matters is if you're willing to be treated, you may live much longer than anyone else will ever tell you.
At Brigham and Women's and many other institutions, Memorial Sloan Kettering, Baylor, there's often clinical trials hosted at these locations and kind of led by the surgical team and the research team. Are you going to look to, and this might not be right away, obviously, because again, you're kind of trying to form and organize and kind of create this new program, but at some point, maybe in the near future or in the future in general, are you going to look to try and get Advent Health more at the forefront of hosting these clinical trials for mesothelioma? Because that is a big part. These clinical trials are a big part of kind of the development of new treatments and the, I guess, evolution and progression of, maybe, extending life, having a better prognosis, kind of making some of those numbers that you talked about get better in terms of survival rates?
I'm glad you asked that question. Yesterday, I had a meeting with, my office, if you were to walk up to the Cancer Institute at, 2100, I think, Orange Avenue, Advent Health, and go to my office and ask for my office, you're going to find out in the front door of my office is translational research. And you say, why is Dr. DaSilva office inside the translation research office? Because that's what we're going to do. Every single patient going to enroll in a protocol. Yesterday, we had a meeting with the translational research team, biostatistician. We're putting together 2 protocols, and we hope to launch as soon as February the first protocol that we're going to have for research within our treatment plan. So yes, that's one. And the team was very excited when I explained to them, what's out there right now, how dismal it is, and that we can actually make a difference by, increasing survival in our patients. They are really excited with this new possibility, a new research area that they never had before, which means mesothelioma. That's number one. Number two, I want to make sure that everybody knows about this because it's not a secret anymore. We have signed up a agreement with Moffitt Cancer Center in Tampa to perform exactly what you described, to give our patients access to different protocols through Moffitt. So if we don't have here, we make sure that we get through Moffitt, but the treatment care and plan and delivery of it will be done here. So we have a great association with the final stage just to kind of iron out the fine details, as you know, but that agreement between us, Advent Health Cancer Center, and Moffitt has been signed to that specific question. We will have different protocols, not only for mesothelioma, lung cancer, esophageal cancer, mesothelioma, germ cell tumors, but specifically for mesothelioma, yes. And I am going to conduct my own protocol research here at my translational research lab.
You mentioned the treatment plan that you guys are installing, or that you and your team are installing at Advent Health. Each patient is different, so each patient obviously is, or likely will have a kind of unique treatment plan and treatment strategy. But what does that treatment plan look like at Advent Health? How, is it significantly different from other institutions? Is it different in a very unique way? What is kind of, I guess, your mindset and your idea when you go in and kind of, I guess, develop a treatment plan for pleural and peritoneal meso? And obviously those are 2 diseases. They have their own plans in and of themselves with different types of surgery. But, I guess, what does that look like when you talk about treatment plan?
So that's a great question. So there is a guidelines that was published last year, which is the guidelines that helps all institutions across the country to follow a treatment plan and offer different treatment plans. So we're not going to deviate from the protocol and the guidelines. They are very good. They're strong protocols and guidelines. So that calls for patients who may or may not be surgical candidates, but calls for chemotherapy, either as a neoadjuvant setting. So you get your chemotherapy with standard Alimta and cisplatin based. And the protocol and guidelines also ask for protocols in association with that, either using Avastin or a second line of therapy. But the guideline is pretty clear. So patients should get, if they will be surgical candidates, neoadjuvant followed by surgery, followed plus adjuvant therapy, depending on the surgical procedure. If they're not surgical candidates, you may offer them protocols driven with immunotherapy and skip the standard of care chemotherapy. Or if you cannot get immunotherapy, then you get what we call consolidate chemotherapy, no surgery. So those guidelines are pretty strict, and they're out there for everyone to read it, and we're going to follow them. What we'd like to do is add our own protocol as the guidelines calls for in patients who are surgical candidates and can have the initial standard of care, which is cisplatin-based or platinum-based chemotherapy, followed by immunotherapy, followed by surgery. That'll be ideal for us, and that's what we're going to do.
So you would like to add, again, like ideal situation, you'd like to add immunotherapy to a multimodal approach that includes surgery, which in a lot of instances, that is kind of something that's utilized in clinical trials and is experimented in clinical trials. So
That's correct.
And I was going to ask what your views are on some of these emerging treatments like immunotherapy, gene therapy, virotherapy.
Yes.
And it seems like you are a fan of immunotherapy.
I am, but I want to make one point very clear, which is important for patients. So when we go out and talk to communities and talk to physicians, and we have the possibility to travel across the country and other places to talk about that, it's important to realize that, yes, I'm a big fan of immunotherapy. I think within the next 5 years, immunotherapy is going to be the standard of care. However, only about 5 to 6% of the total population with cancer, specifically mesothelioma, would be candidates for immunotherapy. So the bulk of the patients, because in order to receive immunotherapy, you have to have the right receptors or the target therapy. Mm-hmm. So most of the patients will not have that, or the tumor is so heterogeneous. So in other words, the DNA is so different that would not respond to immunotherapy. So the majority of patients will not be candidates for immunotherapy. Why do I say that? Because if patients go to a place in which all they have to offer is immunotherapy, that may not be the best thing for you. The reason is, unless your tumor is sensitive to that specific immunotherapy, then there will be no response and you get all the side effects with it.
Last question, and I know that you're busy, again, setting up a mesothelioma program at a hospital, so obviously I know that your time is valuable. Last question, though, at Brigham and Women's, the mesothelioma staff and surgical staff, some of them worked, I think actually one, Dr. Lebenthal, worked at the Boston VA Medical Center. And there are other mesothelioma facilities and hospitals where a surgeon or a specialist will work at the local VA center. There are not a lot of VA medical centers, that have mesothelioma programs and have a staff that can help treat veterans with mesothelioma. The VA in Orlando, I do not believe has a mesothelioma program currently. Is that a possibility for you? Just because of your experience working in Brigham and working with Dr. Lebenthal, is that something that could develop? Just because veterans oftentimes are, they're looking for a hospital that has a mesothelioma program, but if there's only 3 or just a handful throughout the United States, you have veterans here in the Southeast, and it's going to be, again, a difficult time in terms of travel to get to one of these centers. I'm not sure if that's on your radar, if that's something that you've thought about or discussed, and it could be a long way into the future. But that's just a question because I know we have a lot of veterans that come to our website and speak with our staff, and they're trying to look for treatment nearby.
Yeah, so those are great questions. So here in Orlando, I think they are probably almost completed with a new VA center and VA hospital. I think they went through renovations. I'm not privileged at the VA yet. Mm-hmm. If the VA would like me to be part of their team, it would be great as a consultant. The issue with mesothelioma, it requires a lot of resources. You need to have the operating room. You need to have the critical care unit. You need to have the pulmonologist, the cardiologist. You have all that buy-in group, the medical oncologist, radiation to buy into the program. So mm-hmm. It's just not one. Now, having said that, I usually say this. Anyone who's willing to tackle that is welcome, and I would love to be part of that, either as a consultant or maybe even create that program if in the future my time and efforts will allow me to do, because you're right. The number of veterans coming up with mesothelioma keep increasing, and we see more and more and more, and it would be great if they would have a home to go once they have their disease. Meanwhile, what we did until Dr. Lebenthal created his program in Roxbury is we see all the veterans at the Brigham, and now if they're more than welcome to come and see me here.
Exactly, and that's I think that's kind of how, I mean, correct me if I'm wrong, I'm not super well versed in how the VA medical center does referrals, but obviously if the VA medical center that a local veteran goes to cannot treat their disease, then there's a referral program. Maybe they can send them to a local hospital. Maybe they have to send them to another VA center that actually does treat that disease. I know there is kind of that referral aspect with the VA center, and I also know it does take a lot to set up this type of program. Houston, through Baylor, I guess, or with the help of Baylor staff, is just now starting to set up their own meso program, and they kind of talked about just how much work goes into just getting the equipment and getting the staff and getting the resources, like you said. So Dr. Marcelo DaSilva, thank you so much. Again, the Chief of Thoracic Surgery Services and the Department of Thoracic Surgery at Advent Health, and a medical director at Advent Health, starting and kind of, I guess, forming and creating a mesothelioma program at the hospital, at the medical group, and kind of organizing the staff of, basically everyone, oncologists, you name it, and kind of getting them all, like you said, all under one umbrella. You have a talented staff and you have the resources there, and kind of organizing it all under one umbrella to allow mesothelioma patients here in Florida and the Southeast to have a more local option versus, I guess, the just the grouping that often occurs with, in Texas and in the Northeast and on the West Coast. There aren't a lot of options here in the Southeast, and so it's great to hear that Advent Health in Orlando is forming a mesothelioma program, and it's great to know that you're here. Thank you for joining us again and for giving us your time. Again, I know it's valuable. I'm not sure if there's anything else you want to say to us, to patients of mesothelioma, to families of patients, just to sign off, but if not, I really do appreciate it.
Yes, I do. As I said at the beginning of our talk, mesothelioma patients have a special place in my heart, but I want to tell them this. We're open. We have state-of-the-art program here. I already saw 3 patients with mesothelioma. In a short time I have been here, I'm hoping to bring quality and hope for those who are given this awful diagnosis, but that doesn't scare me a bit. I've been doing this for 15 years. I know how to do it. We can do it. I have a great team with me, a state-of-the-art team. And again, don't forget, with this hope in the equation, anything is possible, and I'm here to bring hope to the patients with mesothelioma. Thank you.
Dr. DaSilva, thank you so much, and have a good rest of your day. And to all the people who have been listening, thank you for listening to our podcast interview with Dr. Marcelo DaSilva of Advent Health.